department. Several years ago, you might have found one of us knocking on your door, asking you a bunch of weird questions about health and priorities and what's going on in Hancock County. That would have been us. We went around and we polled your community. We've done it twice. And that's because we didn't feel like, as a health department and as a health coalition, we needed to sit around in a little circle and say, this is what Hancock County's problem is. That's not effective and that's not really going to solve anything. So we went out and asked residents of Hancock County, what do y'all think the issues are in terms of health? The first issue they came up with was access to care. That can mean a lot of things. That can mean people not accessing the care they need through lack of doctors, not being able to get to the doctors, which let's give Tina and Lana, some of them, a round of applause because Hancock County did receive $55,000 for a grant for a van that will transport people in need to the doctor's appointments and things that they wouldn't ordinarily be able to get to. So they worked really hard on that grant, and that was through a collective effort through our health coalition. That's something that may or may not have gotten done if we hadn't come together as a group. The second issue that we have picked, not we, but the community said was an issue, was obesity. And as you all know, a lot of us, you know, I'm really struggling to stay away from my second brownie. It is an issue though. A lot of us are struggling. The brownies aren't helping. But you know, I know my husband works at Southwire, and you know, they spend a lot of time trying to help their employees through contests, through different things, to think about their health, to think about, you know, are they smoking, or, you know, are they overweight, and they're trying to help, you know, because economically, that's why we're here at the chamber. While you individually might not have a lot of health issues, we as a community, all of our communities have health issues, and we're paying for it economically. I'm sure you all that employ people, you're paying for it through insurance. We're paying for it through recruiting of businesses. There have been instances of places across the country, businesses start to look at how healthy is your community. Do you have a lot of smokers? Do you have a lot of people that are overweight? Do I really want to plant my business there when my insurance costs are going to be high? So obesity was something that was really picked and really thought to be a part of the issue in Hancock County by the citizens. So that's another issue we're working on. We've had, Tina had the 100-mile club celebration last night. We had people signing up to commit to walk 100 miles between Memorial and Labor Day, you know, to kind of get them moving, get them thinking about their health, get their exercise. The last issue they picked, and these issues were across the board for all 7 counties pretty much. The last issue was substance abuse. Now, I know most of us have been touched by some form of substance abuse, whether it be smoking, alcoholism, drugs. You know, the smoking rate in Kentucky, I did a presentation to a bunch of high school kids yesterday, and I was like, we're #1. We're not anything good. We're #1 in smoking rates, youth smoking rates, cancer, heart disease, you know, yada, 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 all the bad things. So, you know, substance abuse is a really big issue that we really need to tackle, and we've had the Hancock County Partners for a few years, and they're part of our work with our coalition. So that's something else that we really need to focus on according to the people of Hancock County. Why we're here is we're asking you, well, first of all, we're going to tell you, hey, we're over here, so don't be surprised if you see us somewhere. And, you know, join us. Our meetings are the second Friday of the month at noon. So if anybody gets a lunch hour that time, come join us for a meeting. But you don't have to come to a meeting to be a part of the coalition. Tina's very good about sending out emails, alerts, things like that. You know, if you want to be on an email list and just learn about things we're doing, so you can volunteer maybe at an event, or, you know, you have ideas that would really go great for Hancock County, get with Tina, get with Brooke, and just let us know. If you want to be part of the coalition, you don't have to show up to our meetings, but you could be part of our information and part of our list. The reason it's important is people in Davis County have their own issues, people in Ohio County have their own issues, people in Hancock County have their own issues. It's up to each county to figure out the way they want to do it. We don't want people in Ohio County to tell Hancock what to do. We don't want Hancock to tell Davis what to do. The people of Hancock know what Hancock needs, and that's why it's important to support your health coalition.